Our last speaker, Dr. Mahesh Birla, will speak on Vatarakta and Ayurveda treatment, clinical approach. Dr. Birla.
गुरुर् ब्रह्मा गुरुर्विष्णु गुरुर्देव महेश्वरा गुरुर साक्षात परब्रह्म तस्मै श्री गुरुवे नमः. Jai Gurudev. Respected dignities on dais and off dais, and ladies and gentlemen, it is really an honor to be in front of you and the wonderful people of all different countries. Today, my topic is Vatarakta, a clinical approach in Ayurvedic medicine. With the blessing of God Dhanvantari, I will proceed and commit that I will finish before he will stand. I have been practicing Ayurveda in India for last 19 years at Jalgaon, Maharashtra. Vatarakta and Ayurveda treatment, clinical approach. Vatarakta is also interpreted as gout, and it is also called as khuddam because Vat is dominant factor and it is in the joints. The aim of the study is to evaluate the effect of different Ayurvedic classical formulations in Vatarakta. The patients who attended Ojas Ayurveda OPD during year 2014 and shown signs and symptoms of Vatarakta were selected and screened for the test. 30 patients who fulfilled the below mentioned criteria were selected for the study. Keywords are Vatarakta, gout, bala, gudu, chadi, and shodhanam. Hetu are described as in text because time does not permit to explain. Samprapti, that is pathophysiology, we can go through text. There are two main types, Utthan, that is superficial stage, and Gambhir, that is deep stage. Also, Vat, Pitta, Kapha predominant, and Dvandaj and Sannipatik types are explained in text. Roop symptoms, that is Sthanam, Kara, Padangulam, Sarva Sandhya. That is place of pathology starts in the great toe or the thumb of hand, and then it goes upwards to the big joints. And Pidakodgama, that is evolution of tophi in the joints. The specific symptoms of Utthan and Gambhir types are explained in book. Chikitsa, that is treatment. We can go for treatment by two ways, that is Shamanam and Shodhanam. Shamanam is a curative therapy, that is internal medicine, and Shodhanam is a unique detoxification process explained in Ayurveda as Panchakarma. The aim of study, the study design shows the aim of study to evaluate the effect of different Ayurvedic criteria formulations in Vatarakta. Source of data from Ojas Ayurveda, Jalgaon, India. Inclusive criteria, patients between 20 to 70 years were selected irrespective of sex, occupation, and caste. Patients started pain with Parva Sandhi, especially great toe or thumb were selected. Patients with typical shiny reddish skin with Tivra Sparsha Sattva, that is tenderness, were selected. Had history of typical hetus, that is causes described in text, were selected. And patients having chronicity less than 1 year. No blood investigation concern in this study, like uric acid and other. Exclusive criteria include, shows subjects with uncontrolled metabolic disorder and other systemic disorder, subject with autoimmune disease of joints, and subjects with infection and communicable diseases. Duration of treatment was around 3 months, and the follow-up for every patient was every 15 days. clinical study and treatment, the patient when comes to me with having symptom of AMA, that is श्रोतोरोध बलभ्रंश गौरवानिल मूढ़ता आलस्य अपक्ति निष्ठिय मलसंग रुचिक्लमा, that is undigested food particle in the gut which goes to the joints. Such patients are initially treated with Ampachanam. Two drugs was used for Ampachanam, that is Amrutottar Kashayam and Guduchadi Kashayam. The patient having Pitta predominance are treated with Guluchadi Kashaya. And thank you. Drugs for Ampachanam are Tikta, Rakta Prasadak and Ruksha in Guna. Uttanavastha was treated with internal medicine, that is Shamanam, and Lepas, Dhara and SOS leech application. The patient coming with acute pain and crying and shouting when comes in OPD, we usually apply leeches, and after half an hour when patient goes out, he is having smiley face. The leech is a beautiful therapy to decrease the pain in Vatarakta. Medicines are only two, that is Bala Guduchadi Kashayam, 15 ml BD with 30 to 60 ml of water at 6 am and 8 pm, and Kaishor Gugru, that is 500 milligram BD as above. The Bala Guduchadi Kashaya contain the key ingredients, that is Bala, Sida cordifolia, Guduchi, that is Tinospora cordifolia, and third one is Vishwa, that is gingiber officinal. Dhara, to decrease the pain and stiffness, Dashmul Kashaya Dhara, Bala Guduchadi oil Dhara, Guduchik Shir Dhara, and Kottam Chukadi oil Dhara were used for Dhara. And Lepas, that is Kottam Chukadi Churna plus Kottam Chukadi oil and Jatamayadi Churna with milk or water as per predominance of doshas. Jalokavacharanam as per requirement. Treatment of Gambhiravastha. The patient who is having deep situated Vatarakta is called as Gambhiravastha. The pre-mentioned medicine are used for the same, and after improvement of Agni, that is after Ampachanam, Panchakarma was planned. Virecha Snehaytvado, Snehayukta Virechane, Rukshairva Mrudubhi Shastam Asakrut Basti Karmam Cha. Seka Abhyangam Pradhyana Sneha Prayo Avidahina. The drugs of Sneha, that is oil, are Avidahina, that is not of Ushna Guna. The two Panchakarma was done, that is Virechan and Basti, because Rakta and Vata is involved. Virechana, for Virechana, the Snehapan with Dadimadi Ghrut or Mahatikta Ghrut was done as per protocol on the day first 40 ml and 20 ml onwards, increasing up to 120 ml on the fifth day. Abhyangam with Pindatelam, the Pindatelam contains Madhuslishta. It is one of the main drug which decreases Vatrakta and tenderness of that disease. And the Swedanam, actually Swedanam is contraindicated in Vatrakta, but apart from that, for vitiated doshas in Virechana, the Swedanam was done in a mrudu manner, that is light manner. Virechan, after Samyak Snigdha Lakshana, Virechan on the 7th day, early morning Sneha Virechan, that is Nimba Amrutadi Erandatelam 25 ml or Trivrut Leyam 10 to 15 gram was given. After Samsarjan Krama of Virechan, a week later Basti, that is Yoga Basti, was planned. Matra Basti with Shirbala oil 80 to 120 ml and Kashaya Basti, Dashmul Kashayam with local Snehanam and Swedanam. Protocol of Basti is day 1 Matra Basti and on day 2 Kashaya Basti onwards up to 7th day lasting with Matra Basti. Other medication used, that is for edema, Gokshuradi Gugru, anemia, Punarna Mandur, constipation, Gandharvastadi, Gandharvaritki, and Rasayan, Kokilaksha Kashayam, and Kaishwar Gugru for next 45 days. Subjective criteria, pain burning sensation, tenderness, edema, discoloration, and walking ability. Score of symptomatic relief of 30 patients is explained in statistical and graphical manner. Conclusion, this study revealed Vatarakta is a complicated lifestyle disease and Utthan Avastha is well tackled with Nidan Parivarjan and Shaman Chikitsa, while Gambhir Avastha needs added intervention of Panchakarma, especially Virechan, Basti and Jalavkavacharanam. Average 60 to 70% patients were relieved with symptoms, but some patients required consistency in treatment more than 3 months. For permanent cure, attention is suggested in Ayurveda. More research can be done with additional criteria of modern investigation. Thank you. Thank you for patient listening.